Next up, we have Dr. Q, who represents the Huda Clinic. For those of you who don't know Huda Clinic, they do some incredible work helping underserved communities in Detroit. Looking forward to hear your presentation, Dr. Q.
Thank you very much, Madia, all you guys for putting this together. This is an awesome program. Forgive me, I just got off of work. Sorry, always on the move. So the thing I wanted to bring to the discussion is the population of the refugees that we're seeing now, or the population of the immigrants that we're seeing now. They have a binding situation with themselves, and I get into that in a little bit. But I just wanted to basically say I don't have any slides. I usually just talk off the cuff because I usually just talk about the experiences that I have with seeing patients. And I'm coming off of like a 12-hour shift out of the urgent care down here in the Detroit area. And a lot of the patients that we're seeing are of the immigrant standing. And I can tell you from a medical perspective, from all the slides that we've just recently seen, amazing slides, amazing presentations, great information, is that a bottom line key underlying common denominator for a lot of the issues that we have is inflammation, stress. And a lot of the situations that we're seeing now, especially with COVID, we see a lot of anxiety has been on the rise as well. And one thing that we try to focus at the Huda Clinic, as well as at the urgent cares that we're at, is an integrative form of medicine. One thing that we started looking into is treating food as medicine before medicine becomes our food. That's a very important aspect of how we try to treat the patients. We want to be able to address to the patients that there is certain foods that we can eat that can help alleviate, if not alleviate, at least reduce a lot of the symptoms of these chronic diseases that patients have had. And the way this relates or parallels to the immigrant process or the whole thought process that we have here is that a lot of patients that get uprooted, or a lot of people that get uprooted right from their lands and from their regions where they're familiar with how that world is cultivated, come to an area where it's all hustle bustle and it's like Steel City here. It's very difficult for them to be self-sufficient by growing their own thing because not many people have this land. We try to integrate farming into the treatment of patients or treatment of the population because it kind of is like a small remnants of back home, so to speak. A lot of people, and we have a large Bengali population that we see at the Huda Clinic as well. And that population, a lot of them in the Hamtramck region as well, they have, with whatever little land they have, they cultivate it. And they tell us all the time that it reminds them of home because this is how they were generationally grown to cultivate their land. But when you come over here in such a stressful situation and you're living in an environment where it's already stressful, coming into an area where there's a lot of greenery and a lot of vegetable, a lot of vegetation growth, it's not only is it therapeutic, but it's also kind of a breakaway from everything that we see usually from the stressors of life. So it's a great parallel for seeing that a lot of the problems that these patients are having is because of inflammation, because of stress, high cortisol levels. What we just heard about the diabetes is a very, very major issue that we're seeing amongst the population. To be able to have them understand what types of food they can use to better their situation, to reduce their symptoms, and to improve their quality of life. That in itself is therapy. For example, okra treats diabetes. It's a very great method to keep blood sugars low, as is celery. Cilantro is great for inflammation, as is turmeric. Dandelion root tea is a great detoxifier for the liver and is great for blood pressure. Blood pressure is one of the most rampant things that we see in the community. Maybe that's why there's so many dandelions growing all over the world. God's trying to tell us something, But this is what we do. If we have an educated patient, we have a healthy patient. And a lot of these patients that are coming in through the clinics, these immigrants that are coming through, they're so much more appreciative of this type of medicine because not only do we integrate Western medicine, for lack of better terms, with the Eastern medicine, for lack of better terms. It's a combination of both frames of mind, putting to the best for the patient. You know, acute treatment would be great for somebody who's having an allergic reaction with Benadryl or something of that nature. But if they have constant or chronic allergic reactions, what is a better treatment? Something like an anti-inflammatory that's natural in your foods, like eggplants or cucumbers. Those are great, or lemons. So we'd incorporate that in their diet. For the chronic, we'll treat them acutely. And with all the work that Access has been doing with Wayne State to get these research numbers, we really appreciate that, because it really indicates where the strength has to be and where the weaknesses are. So we appreciate the collaborative work that the community is doing to make the community healthy. Because like I always say, an educated patient is a healthy patient. That's my story. I'm sticking to it. Thank you, guys. That's all I got.